Hello, I'm Dr. Fumi Bankole. I'm a consultant ophthalmologist with Lagos Province 40 RCCG. I'm discussing with you today a condition called cataract. This topic is very important because cataract is the commonest cause of blindness worldwide. Cataract is a condition that happens when the lens in the eye becomes opacified. The opacification of the lens may occur due to several reasons, and it may occur at any age. Sometimes even children immediately after birth may show signs that this condition is present. When mothers have infections during pregnancy that may cause damage to the lens of the baby. A normal lens, as made by the Lord, is crystal clear, and that is why it allows light to pass through so that we can form clear images of objects. So when the lens becomes opaque, light cannot pass through, and the images that eye forms becomes blurred. In fact, when some people describe the experience, they say that the vision is foggy, or is like harmattan. Everything looks hazy. There is a cloud over objects. That is cataract. In some young adults, cataract may occur due to injuries to the eye, either penetrating injury, in which case there's a sharp object that penetrates the globe and goes into the eye, or contusion, when people give each other a blow on the eye, or we have parents who beat children with belts and other objects which may hit the eye and cause blunt injury or concussion of the eye. Later, when the eye heals, it may later develop cataract. Electric shock, lightning damages, ionizing irradiation damage to the eye may cause cataract. Conditions like diabetes mellitus, that is high levels of blood sugar, may cause cataract by altering the physiology of the lens, and also this kind of cataract matures very fast. Other conditions in the eye, such as inflammations of the eye, some I would call anterior uveitis, chronic type, may later lead to cataract. Other conditions, metabolic conditions in the entire body, may cause cataract. Some other eye conditions also, like eye myopia, have been found to be associated with cataract. So also is acute angle closure glaucoma, because of the a lot of inflammation going on in the eye. When this is treated and the inflammation settles down, later cataract may result. Some medications that we take for other conditions, those who are on medications such as steroid, those who take gold for rheumatoid arthritis, amiodarone for cardiac conditions, and some eye drops we call myotics, which we use for glaucoma in the eye, may later cause cataract. How does cataract present? Cataract presents as painless blurring of vision, which is gradual. It is not sudden. It comes gradually over time. And when this occurs, most people in the initial stages, if you present to your doctor, they will be able to help you with lenses. The lenses aid the eye to still be able to focus light despite the cataract that is developing. But with time, the opacification of the lens gets to a point where even the lenses with glasses would not be able to help the patient anymore, in which case we say that this cataract has become operable. So if you could read on the Snelling's chart by which we check visual acuity, and the only thing you can read is just the first row of letters or maximum second row of letters, that cataract should be treated so that it does not lead to blindness. The treatment for cataract is surgical extraction. There is no medication for it. There is no eye drop that you can use to remove cataract. So many people, when we go to quacks, they may promise that when they give you medication, your cataract will resolve. Those are chemical couching. It's not the appropriate way to remove cataract, because when those local medications get into your eye, all they do is just to dissolve the ligaments that hold the lens in place, so that the lens drops back into the eye. And majority of such cases end up with very bad complications that eventually lead to blindness in that eye. So when you are told you have cataract and you need operation, please don't run away. It's a safe operation that can be done within 30 minutes to 1 hour, and you will come out with good vision at the end of the operation. Some people ask, there are some myths around eye operations. Do doctors actually remove the eyeball, take it into a bowl of water, wash it, and put it back? Definitely not. Because if an eye is removed, then what attaches that eye to the brain has to be cut. So we don't remove the eyeball. Just like any other part of the body, when an operation is to be done, a little incision is made in the upper part of the eyeball. Through that, the lens is carefully extracted and the soft lens matter is washed out. There are special instruments by which this is being done, and it is very safe. The eye heals well and recovers, and then we will have very good vision after the operation. So cataract is a condition that causes blindness, but there is a very effective and efficient way of treating it surgically, such that the vision in that eye is retained at the maximum or best way possible. So don't run away when you are told you have cataract. It's only one of those things that comes with longevity. And I pray that we have long life and good health to enjoy it. Thank you.